Good evening to each and every one of you. You are listening to The Drive at 5 Live, and I am your weekly host, Patricia McDowell, and I'd like to welcome each and every one of you to The Drive at 5 Live. Each week, we will discuss health and wellness. We will guide you to the road to a better and healthy lifestyle with beneficial results. Well, ladies and gentlemen, I hope everybody's getting very close and ready for the Christmas holidays. And with that, all of us are going to eat all kinds of goodies and snacks and visit with our family. But are you taking care of your teeth during this time, please? Well, we have Dr. William Limongelli. He is a graduate of Howard University College of Dentistry. He is a graduate. He has graduated with honors, as well as made the dean's list. His dental practice is located at 21st Century Dental and Surgery Associates, located in the heart of downtown Yonkers. The location is 12 Warburton Avenue, and his phone number is 914-969-2727. That's 914-969-2727. Dr. Limongelli has taught at Howard University College of Dentistry, as well as Columbia University College, and Harlem Hospital Health Center. Dr. Limongelli has recently received numerous awards from the American Dental Society, and also he has also published many articles. So I'm so happy to welcome Dr. Limongelli, who happens to be my dentist. Are you on the call?
I'm here, Pat. Can you hear me?
Wonderful. Yes, I can hear you. I hear you loud and clear. And thank you for agreeing to be a guest on my show. And I wanted to tell a little bit more to my guests. I listen to say a little bit about yourself and what does your practice consist of, and then we'll take it from there.
Well, thank you very much, Pat, for having me on your show. And I've been in the Yonkers area, the downtown Yonkers area ever since 1992. It's approximately 18 years. And my practice consists mostly of full mouth rehabilitation, cosmetic dentistry, and for the most part, general dentistry and oral surgery.
Mm-hmm.
We take a considerable amount of insurance plans here, as well as private patients, and we, after being in the practice that long, are now trying to give something back to the community. Right now we have in progress a toy drive for the children. As we all know, some of the underprivileged children really don't have too much to look forward to at Christmas time, and this is a way of trying to help them out a little bit. We're doing it in conjunction with the Salvation Army. It's in progress now, and it closes on December the 22nd. So I'd like to take this opportunity to encourage all of your listeners to stop by the office and contribute some toys that they may have to help the kids out.
That is a fantastic idea, and it's a wonderful thing to do for the community. I mean, instead of just coming in and doing your classes, you actually care about the community in which you serve, and I really commend you for all that you do and continue to do for the people within your community, your business community.
I'm really a hometown boy with Yonkers. I grew up here. I did my elementary school and high school here, and then I went away to study at college, and then I came back again, and I'm still here after those years.
Wow, that is absolutely fantastic. Dr. Limongelli, why is it important that we maintain our health of our teeth?
Well, the teeth are very important because they're the gateway to the body, really. And it's important to maintain good oral health because if you don't, it can lead to a variety of diseases. And also diseases have an impact on the teeth, specifically systemic diseases such as diabetes, which attacks the microcirculation and causes the teeth to become loose. If you are attentive to your teeth and come every 6 months for checkups and cleanings, and your oral hygiene is good, there's a good chance that the severity of the effect of the diabetes would not be.
Hello?
Women develop pregnancy gingivitis. And I found that if they come to the dentist every 6 months, maintain their oral hygiene, it's not that much of a gingivitis during the pregnancy period.
And Dr. Limongelli, for a family, how young should a parent, for example, start bringing their children in to start the right track on seeing a doctor on a regular basis?
Well, we usually start them at 4 years old, and that is a good age to start to bring the kids in. It gets them used to seeing the dentist, and it gets them used to getting the cleanings done that are required to maintain their oral health. Of course, if a child has some severe problems, caries teeth and pain, they can be brought in at any time. The very young ones are probably best off treated by a pedodontist who are very capable at allaying their fears, and they have different modalities to treat them and manage them. But for the most part, most patients from 4 years old up is a good time to start bringing them in.
Very, very good. And how does a mother prepare the child to go to the dentist for the first experience?
Well, for the first experience, it's not really a big thing for the child, provided they're in the proper state of mind. You know, the parents should tell them that they're going to have their first dental visit, and it's something that the parents do on a regular basis. And actually, it could be a fun because what we do on the first visit, other than the exam, we polish their teeth and put fluoride on, and the polishing tickles a little bit, and most of the kids giggle and laugh through it, and it's not a very dramatic thing at all.
Oh, very, very good. Now, for the older adults who, for some reason, are afraid to come in to have their teeth looked at, I know a lot of times it's I think because people are very concerned about the cost factor. Are there a lot of plans out there for those individuals who need dental care?
Yes, there are. There's several health finance plans that we can offer. We offer Care Credit and Chase Health Advance, which is a financing which can be offered for different levels of treatment. And there's a variety of percentage rates that Care Credit and Chase offer. Some are anywhere from 1 to 5 years. There can be some interest-free for the first 6 months. They offer a variety of plans, and we participate in them. And naturally, we also offer all of the major credit cards, Visa, Master, American Express, and Discover.
You started to talk about diabetes and the teeth.
Yes.
If a person is diagnosed with diabetes, is it? I guess it would be imperative that they come see you right away to start to take action in terms of saving their teeth.
Yes, it's very important. As I mentioned, the diabetes mellitus affects the microcirculation, not just in the teeth, but in the whole body. It affects it in the eyes, and these people can have vision problems, diabetic retinopathy. It attacks the microcirculation all over the body, in the skin, which produces some itching from time to time. It attacks the circulation in the heart. A lot of these patients are prone to heart disease and heart attacks. And it attacks the microcirculation of the periodontal ligament in the teeth, which cause the teeth to loosen in time, especially if the hygiene is not maintained.
Wow. And I've also heard that, and I don't know how you can correct me if I'm wrong, but I also heard that sometimes the heart can be affected by the teeth that are not treated properly or cared for,
yes,
or in bad condition. Is that true?
Very true, especially the valves of the heart. The valve leaflets of the heart, especially with valvular heart disease, mitral valve prolapse, they have an affinity for bacteria around the necks of the teeth, which get into the circulation during cleanings or any invasive procedure where you have dental work done. Not only that, but tartar that forms around the teeth is very irritating and sort of sticks the gums from the inside. So when the gums are pressed over this hard calcified material, they start to bleed. And bacteria that have gathered around this tartar get into the circulation and can affect the valve leaflets of the heart.
Oh, I see. Wow. That's kind of scary. That's kind of scary. So it really is imperative that people.
It's a little unsettling.
Yeah,
but,
it really is.
With proper dental care, a lot of this can be avoided.
And what would so you say that each person on an average should come to see the dentist twice a year?
6 months is recommended.
And then what generally happens during that time, every 6 months?
Well, every 6 months they get exams and cleanings, and X-rays are taken to see if they have any cavities. The rest of the mouth is visually inspected, and they're given a good cleaning to remove any tartar or plaque from around the teeth.
Mm-hmm.